prostate cancer occurs in about 1 in 6 American men. And the older a man gets, the higher his chance of getting prostate cancer. And it does have a family history. If a man has a male relative, such as a father, brother, grandfather, uncle, who has prostate cancer, he has a 2 times chance of getting prostate cancer in his lifetime. If he has 2 or more relatives, he has at least a 4 times risk of getting prostate cancer. Right now, the best screening methods we have for prostate cancer would be the digital rectal exam, or a rectal exam to feel the prostate. Since the prostate sits in front of the rectum, that's the easiest way to get to it. And also a blood test called a PSA, which stands for prostate specific antigen. And together, those are our current best screening efforts. Surgery is one of our mainstem of treatment there. That and radiation are your 2 primary treatments. But prostatectomy is to remove the prostate and then to reconnect the urinary tract. And when we do so, the advantages of taking the prostate out is if the cancer is limited to the prostate and we remove it, it's out of the body. Up until the past decade, open surgery was the only way we did things. And that involves an incision in the lower abdomen, and we go down and sometimes look at or remove the lymph nodes in the pelvis as well. Well, now we've evolved to using laparoscopic techniques, and even more so robotic assisted. The robot is an extension of my hands. I or whoever is using the robot as the surgeon is actually doing the operation. And again, it's not a machine doing this independently. It's pretty much a precision tool, and it allows us to look into the pelvis, which is a confined area, with a 3-dimensional type of camera. There's typically 5 or 6 little small incisions that are about the size that maybe a pencil would fit through. The one that goes up above the belly button may be a little bit larger because that's where the prostate comes out. And sometimes, depending on the prostate size, we may have to enlarge that just a little bit. But I tell guys within 6 months, typically you're not going to be able to find your incisions, so you don't have a big scar. Your recovery time after surgery is about half of what you would from open. Typically, your hospital stay is only about 24 hours, and your catheter would only stay in about a week versus a couple of weeks, and return to full activity is about half. I usually tell my guys that play golf that you can be back on the course in about 3 weeks typically, as opposed to maybe 6 weeks after open surgery. We have really come through the infancy of a program and actually turning into be a nice robotics program to where patients know exactly what to expect and their expectations are met and hopefully surpassed with satisfaction.